Today I will discuss about physiology of micturation and micturation reflex. So, what is micturation? Micturation is the process whereby the urinary bladder empties when it becomes filled. This process involves two main steps. The bladder fills progressively until the tension in its walls rises above the threshold level. The elicitation of nervous reflex called micturation reflex that empties the bladder or causes a conscious desire to urinate. Which type of reflex micturition reflex is? This is autonomic, the spinal cord reflex. It can also be inhibited or facilitated by centers in the cerebral cortex or brainstem. So let us know about the physiologic anatomy of the urinary bladder. Urinary bladder is a smooth muscle chamber composed of two main parts. One is body and the neck. Body, which is the major part of the bladder in which urine collects, and the neck, which is a funnel-shaped extension of the body, passing inferiorly and anteriorly into the urogenital triangle and connecting with the urethra. The lower part of the bladder neck is called the posterior urethra because of its relationship to the urethra. Next, we'll have to know about the dead cell muscle. The smooth muscle of the bladder is called dead cell muscle. So you should remember it. What is the name of the bladder muscle? That is called dead cell muscle. The muscle fiber extends in all directions and when contracted can increase the pressure in the bladder 40 to 60 millimeter mercury. Contraction of the detrusor muscle is a major step in emptying the bladder. When it contracted, bladder is emptied. Small muscle cells of the detrusor muscle fuse with one another. So when action potential generated, it is spread throughout the detrusor muscle and contract at a time. What is trigon? On the posterior wall of the bladder, lying immediately above the bladder neck, is a small triangular area called trigon. At the lowermost apex of the trigon, the bladder neck opens into the posterior urethra and the two ureters enter the bladder at the uppermost angle of the trigon. So, triangle is triangular shape, the lowermost apex connected to the posterior urethra and the uppermost two angles are connected with the two ureters. So trigon can be identified by the fact. How can you identify trigon? It can be identified by its smoothness, whereas in other parts of the bladder is folded to form rugae. Internal sphincter, the bladder neck, that's posterior urethra, is 2 to 3 centimeters long, and its wall is composed of retrocell muscle interlaced with a large amount of elastic tissue. This forms the internal sphincter. Its natural tone normally keeps the bladder neck and posterior urethra empty of urine, therefore prevents emptying of the bladder until the pressure in the main part of the bladder rises above a critical threshold. Internal sphincter is involuntary. External sphincter. Beyond the posterior urethra, the urethra passes through the urogenital diaphragm, which contains a layer of muscle called external sphincter of the bladder. This external sphincter is voluntary. Innervation of the bladder, that's mean nerve supply. It has three nerve supply: pelvic nerve, pudendal nerve, and hypogastric nerve. Pelvic nerve, it has both sensory and motor fiber. Pudendal nerve is motor to external sphincter, and hypogastric nerve sympathetic to the blood vessel and sensory to the pain sensation and fullness of the bladder. This is the nerve supply, that is pudendal nerve supplies to the external sphincter, pelvic nerve to the bladder. This is sensory and motor. Hypogastric nerve, this is sensory, that makes sensation of fullness and pain. So pelvic nerves, this is the principal nerve supply of the bladder. Connects with the spinal cord through the sacral plexus is 2 and 3. It has both sensory and motor nerve supply. Sensory fibers detect the degree of the stretch of the bladder wall. The motor nerves transmitted in the pelvic nerves are parasympathetic fibers. These fibers terminate on the ganglion cells located in the wall of the bladder. Short postganglionic nerves then innervate the depressor muscle. Pudendal nerve. We have already known that it supplies the external sphincter. It is these fibers are somatic nerve fiber that innervate and control the voluntary scatter muscle of the sphincter. Hypogastric nerve. The bladder receives sympathetic nervation from the sympathetic chain through the hypogastric nerves, connecting mainly with the L2 segment of the spinal cord. Its function is to stimulate mainly the blood vessels, carry sensation of fullness and pain. So next, urine transport from the kidney through the ureters and into the bladder. Urine comes from the kidneys through the ureters into the bladder. Urine flowing from the collecting duct into the renal calyx stresses the calyx and increases their inherent pacemaker activity. This initiates peristaltic contractions that is spread to the renal pelvis and then downward along the length of the ureter. This means the pacemaker activity starts from the calyx, renal calyx. The ureters are normally 25 to 35 centimeters long. The walls of the ureters contain smooth muscle and are innervated by the sympathetic and parasympathetic nerves that extends along the entire length of the ureter. Peristaltic contraction of the ureter are enhanced by the parasympathetic stimulation and inhibited by the sympathetic stimulation. So the ureter contains smooth muscle that is supplied by sympathetic and parasympathetic nerve. Its peristaltic contraction in the contractions are enhanced by the parasympathetic stimulation, inhibited by sympathetic stimulation. Each peristaltic wave along the ureter increases the pressure within the ureter so that the region passing through the bladder wall opens and allows urine to flow into the bladder. Some of the urine in the bladder is propelled backward into the ureter called vesico-ureteral reflux. Vesico-ureteral reflux. Such reflux can lead to enlargement of the ureters and if severe, can increase the pressure in the renal calyx and forms hydronephrosis and may cause damage to the renal medulla. Pain sensation in the ureters and the ureterorenal reflex. The ureters are extensively supplied with pain nerve fibers. When ureter becomes blocked, intense reflex constriction occurs, which is associated with severe pain. Spasmodic pain. The pain impulse causes sympathetic reflex back to the kidney to constrict the renal arterioles, thereby decreasing urine output from the kidney. This effect is called ureterorenal reflex. So, what is ureterorenal reflex? Ureter takes from ureter to renal. Pain impulse causes a sympathetic reflex back to the kidney to constrict the renal arterioles, thereby decreasing urine output from the kidney. This effect is called ureterorenal reflex. Filling of the bladder and bladder wall tone, the cystometogram. Cystometogram. What is cystometogram? When there is no urine in the bladder, the intravesicular pressure is zero. By the time 30 to 50 millimeters of urine have collected, the pressure rises 5 to 10 centimeters of water. Additional urine, if collected 200 to 300 millimeters, there is only a small additional rise in pressure. This constant level of pressure is caused by intrinsic tone of the bladder wall. Beyond 300 to 400 milliliters, collection of more urine in the bladder causes the pressure to rise rapidly. Superimposed on the tonic pressure changes during filling of the bladder are periodic, acute increase in pressure that lasts from a few seconds to more than 1 minute. The pressure peaks may rise only a few centimeters of water or may rise to more than 100 centimeters of water. These pressure peaks are called micturation waves in the cystometogram and are caused by the micturation reflex. So this slow and steady rise of the pressure of the urinary bladder is um, gram is called cystometogram. These pressure peaks are called micturation waves in the cystometogram. Micturation reflex. As the bladder fills, many superimposed micturation contractions begin to appear as a stress reflex initiated by sensory stress receptors in the bladder wall, especially by the receptors in the posterior urethra. This is called micturation reflex. So you will have to know about the micturation reflex. Sensory signals from the bladder stress receptors are conducted to the sacral segment of the cord through the pelvic nerve. Reflexly, back again to the bladder through the parasympathetic nerve fiber by way of the same nerves. As the bladder continues to fill, the micturition reflexes become more frequent and cause greater contraction of the retrodorsal muscle. That is, initial contraction of the bladder activates the stress receptors to cause a greater increase in sensory impulse from the bladder and posterior urethra, which causes a further increase in the reflex contraction of the bladder. Thus, the cycle repeated again and again until the bladder has reached a strong degree of contraction. Once the micturition reflex becomes powerful enough, it causes another reflex which passes through the pudendal nerve to the external sphincter to inhibit it. If this inhibition is more potent in the brain than the voluntary constrictor signals to the external sphincter, urination will occur. If not, urination will not occur until the bladder fills still further and the micturition reflex becomes more powerful. Next, we will have to know about the abnormalities of micturition. What is atonic bladder? What is automatic bladder? What is uninhibited neurogenic bladder? Atonic bladder caused by destruction of the sensory nerve fiber Automatic bladder caused by spinal cord damage above the sacral region. Uninhibited neurogenic bladder caused by lack of inhibitory signals from the brain. What is atonic bladder? Micturation reflex contraction cannot occur if the sensory nerve fibers from the bladder to the spinal cord are destroyed. That means no tone, no sensory sensation in the bladder. In this case, instead of emptying periodically, the bladder fills to capacity and overflows a few drops at a time through the urethra. This occurrence is called overflow incontinence. When this happens, a person loses bladder control despite intact efferent fiber from the cord to bladder and despite intact neurogenic connections within the brain. What are the causes of atonic bladder? One is crush injury to the sacral region of the spinal cord. Another is infection, that is syphilis. Syphilis can cause constrictive fibrosis around the dorsal root nerve fiber. So, sensation of pain sensation will not enter into the spinal cord. This is called TAPS dorsalis. And the bladder is called tapetic bladder. Automatic bladder caused by spinal cord damage above the sacral region. If the spinal cord is damaged above the sacral region but the spinal cord segments are still intact, typical micturation reflexes can still occur. However, they are no longer controlled by the brain, as because from the brain the inhibitory signal that will come will be crossed in the sacral region, as the sacrum above the sacral the spinal cord is damaged. During the first few days to several weeks after the damage to the spinal cord has occurred, the micturation reflexes are suppressed because of the state of spinal shock caused by the sudden loss of facilitative impulses from the brainstem and cerebrum. However, if the blood is emptied periodically by catheterization to prevent bladder injury caused by overstretching of the bladder, the excitability of the micturation reflex gradually increases until typical micturation reflex return. Then periodic bladder emptying occurs. This is called automatic bladder caused by spinal cord damage. Okay. Uninhibited neurogenic bladder caused by lack of inhibitory signals from the brain. Another abnormality of micturation is the so-called, which results in frequent and relatively uncontrolled micturation. This condition derives from partial damage of the spinal cord or brainstem that interrupt most of the inhibitory signals. Facilitative impulses passing continually down the cord keep the sacral center so excitable that even a small quantity of urine elicits an uncontrollable micturation reflex, thereby promoting frequent urination. Uninhibited neurogenic bladder. Uninhibited. So, facilitative impulse passes down the cord, keep the sacral centers very excitable, as this is not inhibited by the brainstem. So, it is hyperactive. And if a small amount of urine collected, it causes elicitation of micturation reflex and thereby frequent urination or micturation will happen. So it is called uninhibited neurogenic bladder. So thank you. Uh, you will have to read this micturation and micturation reflex, and this is referenced from Guyton and this figure from Gannon. So you will have to study through the Guyton for this micturation and micturation reflex. Thank you. Thank you to all.